Cliff and I joined Christian Healthcare Ministries because we really liked the concept of Christians sharing each other's burdens. And it's not just a slogan, it's actually, they really put it into practice. And we really experienced that firsthand when Cliff was diagnosed with heart disease. And it became just too much for us to manage all the financial difficulties on our own. His heart disease was a pre-existing condition, and we knew when we joined that Cliff would probably need more medical attention at some time in the future. Sadly, it was a long year of his declining health. His pacemaker and defibrillator started going off often two to three times a month. So when we joined Christian Healthcare Ministries, we decided to choose the Gold program because we knew that we were probably in store for some big medical bills in the future. And we also joined Brothers Keeper to remove CHM's sharing maximum. Adjusting to a new system of paying for healthcare was kind of tricky, but CHM was extremely helpful and answered our questions, which were many, about negotiating with healthcare providers. And the doctors gave us self-pay discounts, most of the time with no trouble at all. When Cliff needed an ablation, the hospital was a little more difficult to work with, and that's where CHM stepped in, and they really helped navigate that water with the hospital and the payment, and he was able to get the ablation. The remainder of our medical bills were shared through the Christian Healthcare Ministries prayer page, where the members pay a certain amount each month to help other members with their mounting hospital bills. And it was such a blessing to receive that check every month and to know that that was going to be coming and that we'd be able to pay on our bills on a monthly basis. I can't put into words what that meant and what a relief that was through all that we were going through. It was a long year of declining health with Cliff's pacemaker going off more and more often, and his decline in being able to breathe and being able to walk and drive. His doctors really didn't offer us much, but this is what heart disease is like. And through a God-ordained meeting with a woman who'd undergone a heart transplant 7 months earlier, we were able to get Cliff on the transplant list. And so he spent 7 months in the hospital waiting for a transplant. And in the midst of that, we were on the prayer page at Christian Healthcare Ministries, and so we received over 300 cards and handwritten notes from members throughout the country, and Cliff saved every one of them. He kept a map of the United States in his hospital room, and every time we got a letter from a state, we would color that in. And we received financial support from the prayer page, and it was just such a relief to know that that financial burden was going to be taken care of, and it was all paid within a year after he went home to be with the Lord. We got the heart on November 19th, and it didn't. It never started beating. So on the 22nd, he went home to be with the Lord. In all the struggles that there have been, the finances were not one of them because of Christian Healthcare Ministries. His medical bills were over $400,000 altogether. I didn't once have to worry about how I was going to pay all those bills because the body of Christ came around me and shared the burden, just like they said they would. And that was a huge blessing. There's so many lessons we learned through our experience. Cliff liked to tell people how God had blessed him with boldness during his time in the hospital. I'd like to read something that he wrote. This is Cliff's words. Before entering the hospital, I didn't discuss my faith openly, but I asked God for boldness. He has been faithful, and I've shared my faith with nurses, doctors, and visitors about what God has done in my life. My focus is relating to others and communing with Christ, not about getting a new heart. God already gave me a new heart when He came into my life. He placed me on a path to receive a new physical heart. But my calling is and always has been to develop a deeper relationship with Him. That hasn't changed with my circumstances. I was so blessed to see the way the Lord used our circumstances to minister to others in the hospital, the staff, the doctors, the nurses. And one of the biggest ways He ministered to us was through the support and the prayers of CHM members. Being on the prayer page really expanded our awareness of the body of Christ and how important we were in God's family. It's a beautiful thing to know that across the country, Christians were lifting us up in prayer and meeting all of our financial needs. I'm very, very blessed to be a part of CHM.